la même lutte fratricide entre Vietnamiens.
Oh, well, does he pipe? Oh, that's all right.
Senator, what is your reaction to this victory?
Well, obviously I'm pleased, but more importantly, I'm pleased for the country because this was very serious business. This was a vast, permanent program that they sought to impose upon the country. And my own feelings in a country where we go in for free constitutional government and where we do it on our own and preserve those incentives and rewards, it meant from that standpoint that this, in my judgment, was a threat to every force and every impelling thing that made America the great country that it is.
Senator Kerr, what's your reaction to the vote?
Well, I'm very happy at the vote, and I feel that it was a very wise decision by the Senate. I'm convinced that it will be accepted with the approval of a great majority of our people. I think it will result in an expansion of health and medical care programs already authorized, which, if implemented by the states, will provide not only health care and hospital care, which was the extent of this amendment, but also medical care, physicians, surgeons, nurses, dental, for every American over 65 years of age who needs it and who is unable to pay for it themselves.
Now, you're speaking of...
The medical care for the aged bill was defeated in the United States Senate. A switch of 2 votes in the Senate would have provided, I believe, for its passage. I believe this is a most serious defeat for every American family, for the 17 million Americans who are over 65, whose means of support, whose livelihood is certainly lessened over what it was in their working days, who are more inclined to be ill, who are more likely to be in hospitals, who are less able to pay their bills. I think they've suffered a serious setback today. But this issue is not confined to them. All those Americans who have parents who are liable to be ill and who have children to educate at the same time, mothers and fathers in their 30s and 40s, I believe they've suffered a serious setback. In 1960, with Senator Anderson, I introduced the medical care for the aged. A change of 4 votes in the Senate in 1960 would have provided for its passage. This year we came closer. I think the American people are going to make a decision in November as to whether they want this bill, similar bills, to be passed, or whether they want it to be defeated. Nearly all the Republicans and a handful of Democrats joined with them to give us today's setback. The election in 1960 was very close. It has meant that nearly every vote in the House and Senate is close. Some we win by 1 or 2 votes, others we lose. We have to decide, the United States in 1962 in November in the congressional elections, whether we want to stand still or whether we want to support this kind of legislation for the benefit of the people. You are going to have a chance to make that judgment. I hope that we will return in November a Congress that will support a program like medical care for the aged, a program which has been fought by the American Medical Association and successfully defeated. This bill will be introduced in January 1963. I hope it will pass. With your support in November, this bill will pass in 1963.